You are now listening to Nailed It, the Orthopedic Surgery Podcast.
Hello, everybody, and welcome back yet again to another episode of the Nailed It Ortho Podcast. And you actually tuned into our Citation Classics. So this is going to be our shoulder and elbow Citation Classics team. They come up with another banger, honestly. This is their 10th episode, and the ones that they've done in the past have done really well, really informative. In this one, they're going to talk about shoulder and elbow injuries in throwing athletes. So if anybody here is interested in athletics or interested really in throwers and really the shoulder and elbow injuries, or if you're a shoulder and elbow physician or a sports doctor or really just your general orthopedist, they go over some of the highest cited articles over the last 10 years or so. They give a breakdown of the different injuries. Again, another great episode in store. So without further ado, let's go ahead and get into today's episode.
All right, everyone. Welcome back to another episode of the Citations Classic Shoulder and Elbow. Today we are going to be talking about the shoulder and elbow injuries in throwing athletes. We have pretty much the same team back. People were pretty busy this week, so we have myself, Matt Alben, Matt Corsi, Jalen Warren, and then we also have Danil Chernov joining us as well, who is an MS2 from Buffalo. So without further ado, we'll get back into the shoulder and elbow injuries for throwing athletes. So for those that are joining us on the YouTube version, there is a graphic on the screen kind of showing the basic throwing mechanics that are pretty highly tested on the OITE. So anyone who's played baseball or a throwing sport kind of can relate to this, but if you need a graphic, you can always just put this in your Google and find it. So the first is the wind-up phase. The second is the early cocking, where you're bringing that arm back to throw. Third phase is your late cocking phase, where you're starting to throw. Then fourth phase is when you really accelerate. And then the fifth and sixth phase are deceleration after you've released the ball, and then ultimately your follow through. I won't belabor the point too much. We have a pretty good article that Matt Corsi is going to talk about first here, which will definitely go into more depth with that. Before we get into that, there is just some basic prior literature about shoulder and elbow pain. Obviously, in the throwing athlete is definitely a difficult problem to deal with, and any pathology that requires surgery, there is a risk of the athletes not getting back to their former level or top level of play. Some of the prior research has shown that there's increased risk of injury with increasing age and level of play. So we have a different variety, kind of just discussing general shoulder and elbow topics from the throwing athlete, as well as some youth athlete studies as well. Again, these are your shoulder and elbow citations classics. So these are older, but these are the most highly cited articles and can be kind of the groundwork for some of these newer studies as well. So with that general background, we'll jump into our first article.
All right, welcome back, everyone. So this first article, it's in the Journal of Orthopaedic Sports Physical Therapy. It's titled Biomechanics of the Elbow During Baseball Pitching. This article was published by Werner et al. In the year 1993. So just to break this article down into its basic design, ultimately the study wanted to quantify joint kinematics as well as joint kinetics and muscle activity about the elbow and explain the relevance of these results for injury prevention and rehabilitation in baseball pitchers. So the study population included 7 college-aged individuals who also included some minor league pitchers. They used 7 pitches for data collection, and they used a synchronized high-speed video data recording software as well as surface electromyographic activity for data collection to look at muscle activity during the sequences of the pitch. So the muscles monitored included the biceps, the triceps, the wrist flexor pronator group, as well as the wrist extensors and the anconeus. So in their motion analysis, they quantified joint kinematics, including joint angles and velocities throughout the pitch. They also looked at the kinetics going through the shoulder as well as the elbow, looking at force and torques around the elbow. And then they use, once again, the electromyography to look at muscle activity, harkening back to those muscles that they were looking at. Next slide, please. So just to go into the results a little bit more, first they discussed kinematics during the sequence of the pitches, and those following along You can see graphs here on the figures in the right, as well as the different sequences of the pitch. So they showed that elbow flexion was constant until max external rotation. And then it ultimately extended from about 85 to 20 degrees near the time of ball release. So if you're looking at the graph to the right, you can see that at the very top in figure A, elbow flexion was pretty constant right until it began to dip off. And then that's when you had elbow extension until release is when you had full elbow extension. They also show that there was a rapid downward slope of the elbow flexion curve just prior to ball release. So, and this correlated to max elbow extension velocity of around 2,300 degrees a second just before ball release. They also showed that external rotation of the shoulder reached a maximum value of 185 degrees. And you can see that in the graph to the right for those following along on the video. In terms of kinetics, they showed that there's a compressive force that restricted distraction, and this increased from foot contact until ball release, and it was about 780 newtons. They also saw that there was an extension torque that increased until 40 nanonewtons near when elbow began to extend. Once again, you can see the figures to the right there showing the extension torque graph, as well as it went to maximum external rotation. And then so after release of the ball, max flexion torque occurred at 55 newtons. And then there's also varus torque peaked at 120 nanonewtons before maximum external rotation. They showed that this was the resisting valgus stress near maximum shoulder external rotation. And then finally, they showed a valgus torque peak of 40 newtons after release. So in terms of electromyography, and so this is once again looking at muscle activation during the pitch, they showed that the biceps muscles actively fired until elbow extension, and the biceps also active after release. Imagine if you're winding up to do a pitch, as you're in that early cocking phase, your biceps flexing, leading to flexion of that biceps. You also have triceps active during extension, which makes sense when you're extending your elbow. You get in tricep activation. They also showed that there was a wrist flexor pronator activity throughout the pitch, with max activity before maximum external rotation. There's also some wrist extensors activity before max external rotation, and its max activity was after released, as you'd imagine with that follow-through phase. And then, so anconeus activity was seen to be throughout the pitch and found highest after max external rotation. So once again, this article really was able to break down pitching into a series of 6 phases, as we talked about earlier. So the wind-up phase, and for those looking at the video online, you can see it's through A through C. It starts with the pitcher at the mound and at a neutral stance, and it ends as the throwing hand leaves the glove, and there's minimal elbow kinematics and kinetics during this phase. Next is the stride phase, is shown through C through F. This ends picks up after C, and it ends when the front foot contacts the mound, and the elbow is in about 85 degrees of flexion near the time of foot contact. Then you have the arm cocking phase. Figures F through H, and this ends when the arm was in maximal external rotation. And then importantly, the UCL and the flexor pronator mass provided a varus torque to prevent valgus extension of the elbow, as well as the anconeus and triceps active, which minimizes stress on the UCL. And next, we have the arm acceleration phase through H through I, and this is a dynamic time from max external rotation to release. And then you have the arm deceleration phase, which began at ball release and ended when the arm reached maximal body weight. And then finally, the follow-through begins with max external rotation and ends in the fielding position, shown there in the figure to the right. So some final conclusions that this article was able to draw from. There's really 4 primary functions of elbow during the pitching. The wrist flexor pronator mass helped the UCL generate a varus torque on the medial side during the cocking phase. The increased triceps activity, decreased biceps activity, and centrifugal force due to rotation of the shoulder it generated a large elbow extension angular velocity to accelerate the ball. There was also a large eccentric elbow flexion torque by the biceps needed to decelerate the ball before full extension of the elbow. And also they showed that contraction of all muscles after ball release helped the elbow ligaments apply compressive forces to prevent distraction of the elbow joint. It's also important to note that the muscles act as important dynamic stabilizers in assisting the UCL resist valgus stress, ultimately protecting the elbow. And some important conclusions that we can draw from this is that it really harkens back to the importance of mechanics, and improper mechanics can decrease performance and increase the risk of injury. So having equal muscular strength is important to further prevent injury, and it's also important to have adequate stamina to reduce further injury as well.
Yeah, great job on that article, Matt. Like I mentioned, especially for those that may be listening in residency or M4s or people that are going to be taking the OITE, the in-training exam, this is definitely a highly tested topic. So as you can kind of see, there's a lot of stress placed on the elbow as well as the shoulder, which this didn't touch on as much in late cocking and early acceleration. That's going to be a time for some elbow pathology, UCL, a lot of high strain there, as well as GERD, glenohumeral internal rotation defect, deficiency, as well as internal impingement. And then the deceleration phase is when there's a high amount of stress placed on the rotator cuff muscle as well. So those are just a few tidbits for those taking the OITE. And if you're a med student who's getting ready to go on rotations, if for whatever reason you get asked that question, then hopefully you can impress somebody with that knowledge as well. But yeah, fantastic job. And then we can keep kind of talking about some of the kinetics as well with our next article here.
So kind of expanding on the study that Matt just went over, kinetics of baseball pitching with implications about injury mechanisms, study by Flessig out of AJSM in 1995. Pretty much prior to this point, a lot of the studies were just focusing on the biomechanics of overarm throwing movements, focusing again mainly on like the kinematic motion, but not so much like quantitative data, such as like forces, torques, muscle activity, things like that. Over time, with advanced in high-speed motion analysis and muscle activity studies, kind of provided deeper insights into the forces and torques that contribute to shoulder and elbow injuries in pitchers. So kind of going off of that, this study pretty much subjects 26 healthy, highly skilled adult male pitchers, average age 22, that were all competing at either collegiate or professional level. Were brought in as the study's subjects. I think they were taken from a group of over 200 and ultimately selected for based on a couple different variables of the ability, their level of competing, as well as no injuries within the past 12 months, as well as the ability to have a fastball speed averaging over 84 miles per hour. Reflective markers were placed on the upper and lower extremities, allowing for full body motion capture. Kinematics regarding like joint angles, velocities, and kinetics such as forces and torque at the shoulder and elbow were calculated using inverse dynamics and cadaveric body parameters. Forces were then separated into the shoulder and elbow specifically in regards to like the different planes such as anterior, posterior, superior, inferior, and so on. And then data was normalized to each athlete's height and weight. For pitching phases, kind of just as with that previous study, were divided into wind up, stride, arm cocking, arm acceleration, deceleration, then ultimately follow through. So for results, so pretty much for the, kind of two of the main findings of the study were the critical instants, which were really defined as like the biomechanical danger zones of pitching. These are moments where joint loading is greatest and the risk of overuse injury is the highest. First critical instant was pretty much at the end of arm cocking phase, when you pretty much have your elbow varus and shoulder torque peak. And then your critical instant number 2 is during the arm deceleration phase, when you have the maximum compressive shoulder load. For the end of the arm cocking phase, that's a critical moment for UCL stress and anterior shoulder strain, while during deceleration, that's associated with labral and rotator cuff injuries secondary to eccentric muscle demands. Elbow findings, high valgus loads increase the risk for MCL ligament strain, lateral compression injuries, and posterior medial impingement, while for shoulder, you get high compressive anterior and posterior forces increase the risk for your labral teres rotator cuff strain, and then your subacromial impingement. Next up. And then kind of conclusions for this. The study quantitatively demonstrated the high forces and torques acting on the shoulder and elbow during pitching, confirming and extending prior biomechanical findings consistent with earlier reports. These results highlight two critical incidents, the end of arm cocking and the arm deceleration phase. These data align with established injury mechanisms such as valgus extension overload at the elbow, labral tearing from humeral translation, and rotator cuff and biceps overloading during deceleration. The findings reinforce the literature's consensus that overuse injuries result from cumulative mycotrauma during repetitive pitching. This study underscores the need for balance between flexibility and stability, as excessive laxity increases your instability and the risk of labral or cuff injuries, while insufficient flexibility limits mechanics and performance. By providing robust kinetic data from a large sample of elite pitchers, this work kind of helps strengthen the biomechanical basis for injury prevention, diagnosis, rehab, and highlights where the greatest stresses occur for people to have, targeted pitching programs and things like that to focus on these weak areas.
Perfect. Yeah. Thanks, Matt. Another great, article there, kind of expanding on the prior article to that one. Sorry, I kind of stole your thunder there about the rotator cuff injuries and max force on UCL. I thought we had it in there, but I couldn't remember where, and definitely didn't want to miss that point. But that definitely highlights it as well. But next up, we'll talk about another article now jumping into the 2000s.
Yep. So thanks for having me today, guys. So this article is titled Longitudinal Study of Elbow and Shoulder Pain in Youth Baseball Pitchers. It was published in the American College of Sports Medicine journal called Medicine and Science in Sports and Exercise. And this is by Lyman and all in 2001. So the purpose of this article, the design of this article was a prospective cohort study that followed young baseball players over 2 consecutive seasons between 97 and 98. And they evaluated the frequency of elbow and shoulder complaints in young pitchers, and they looked to identify any association between pitch types, pitch volume, and other risk factors. So they followed around 298 youth pitchers between the ages of 9 to 12 from 2 large baseball youth parks. And they basically conducted all data via post-game phone interviews. They collected age, height, weight, the pitch types, and then the cumulative and per game pitch counts, their satisfaction with performance, general fatigue, and arm pain. And the outcomes were classified as either mild, minor, moderate, or serious. Mild being that they had some pain, but they didn't lose any playing time in the same game or any other games. Minor, they lost some time in the same game. Moderate, they lost some subsequent time in the next game. And serious, meaning their whole season was essentially out. So overall, there were, like I said, 298 pitchers. The average age was about 10.8. 94% of them were right-handed. And total pitching appearances was almost 2,700. Each pitcher averaged about 9 games per season. They averaged about 2.4 innings per game. And then during each game, they had about 43 pitches an average. Interestingly enough, shoulder pain was reported in about 32% of pitchers. Elbow pain was 26% of pitchers. And then either shoulder or elbow was 47% of pitchers. Other arm pain was classified as something like fingers or upper arm, something that didn't quite fall into elbow or shoulder, and that was around 28%. But basically more than 70% of the pain complaints were mild in nature, so they didn't really cause any significant problems for the young athletes. As far as the elbow goes, more than 68% of elbow pain was on the medial side, so somewhere involving that UCL ligament, and it could have had some lateral involvement. About 27% of the elbow pain was on the lateral side without any medial involvement. And what they found was that the odds of elbow pain increased about 6% for every 10 pitches in a game. And there was about a 50% higher risk of elbow pain when you pitched more than 75 times per game. It seemed to be, they also found that a cumulative season value of between 300 to just under 600 pitches was protective for elbow pain. But once you cross that threshold of 600, it leads to significantly increased elbow risk. They did find some data that split finger and sinker pitches, which kind of involve grabbing the seams of the baseball with the index finger and the middle finger and having the thumb, it led to significantly more elbow stress, and it is considered more of an advanced pitch, so that was a risk factor on its own. Older age, heavier weight, shorter height weightlifting and pitching outside of league, and general fatigue and kind of poor self-rated performance were other variables that led to increased elbow pain. And about 29% of shoulder pain was in the superior aspect of the shoulder, and 20% was in the anterior, 20% was in posterior, and 20% was in lateral. And then 10% was kind of scattered across multiple locations. Shoulder was quite different than elbow in the sense that shoulder pain increased 15% per every 10 pitches. And then you had about a 3.2 higher odds of pain with every 75 pitches. So basically, if you constantly stressed it and you had more innings in a single game, that increases your shoulder risk for pain. However, and this is the interesting part, was that if you had more cumulative innings and games during the season, that kind of decreased your risk. So the authors kind of attributed that to a conditioning effect. So independent risk factors were higher per game pitches, and then low seasonal pitches was interestingly finding. And then, as with the elbow, fatigue and poor self-rate performance was another risk factor. So in conclusion, arm pain in young pitchers was common, but usually mild. Older age, higher weight, shorter height, more seasonal pitches, and outside activities usually were linked to higher risks of elbow pain. But shoulder pain was linked to more per game load and eventually also lower cumulative season workload. They kind of attributed that to early season pain being more of a insufficient conditioning problem, whereas late season pain was more associated with overuse, and that is more associated with elbow pain. They did find that fatigue was the strongest signal and had the largest effect for both elbow and shoulder. So what to take away from that would be that if you have a young athlete who is purportedly a high level of fatigue during the game, that's kind of a high predictor of imminent problems coming up. And then change-up pitching, which is a variation of kind of a fastball, but kind of decreasing the velocity toward the end of the pitch, that was showed to be a protective, while kind of more advanced ones like sinkers and splitters, they trended toward higher risk. So in that case, it might be that young players are kind of attempting advanced pitches that they're not quite ready for, and an immature skeleton that leads to increased joint stress. And then they also found that increased risk with age, although this was kind of a small age group between 9 to 12, they did find that the 11 to 12 group had more pain associated with that, and that might have been attributed to kind of secondary ossification centers that are more vulnerable to microtrauma in the elbow. Increased weight could have another factor that could play into it, with greater load being placed on the elbow, especially that medial side. Elbow pain was predominantly in that medial side, and that was consistent with prior reports of kind of valgus stress in youth throwing athletes. And shoulder pain was more often superior and lateral, kind of reflecting more of muscle soreness rather than actual rotator cuff pathology. Etiologies of shoulder and elbow pain are quite different, and recommendations should only be made if the prevention of pain in either the shoulder or the elbow does not increase the risk of the other one. And then there are other recommendations included that pitchers between 9 and 12 years old should not throw more than 75 pitches in a single game, kind of limit the risk of shoulder. And they suggest that over 600 pitches in the season might be a significant risk factor for elbow pain, and that basically all pitchers of all ages should learn and try to use more simple pitches like the changeup pitch, which has a high safety profile, and they should kind of watch their fatigue level during the game. And yep, that's pretty much.
Yeah, great job on that article, Dan. This was definitely one of the earlier study looking at kind of the youth athletes, especially since the first two were looking, at the college and pro sports, as we kind of mentioned. It seems like a lot of these higher level athletes are being attributed to, micro trauma related to youth athlete pitching in different sports. So that was looking at that. And then the next article that we have is by the same group. So again, Lyman, this one's a year later in 2002, looking at something pretty similar, but it kind of builds on top of it. So this is looking at the effect of pitch type, pitch count, and pitching mechanics on the risk of elbow and shoulder pain in youth baseball pitchers out of the American Sports Medicine Institute. So in this one, their objective was to evaluate the association between pitch count, pitch types, and pitching mechanics in shoulder and elbow pain in young pitchers, kind of similar to the last one. This was a prospective cohort of 476 baseball pitchers, again, aged 9 to 14, followed for one spring season, again in Alabama in 1999. They used video analysis of pitching mechanics, qualitatively analyzed in 24 different domains for proper pitching mechanics. And the way they structured this was actually by using a model developed specifically for the study by the American Sports Medicine Institute, as well as the American Baseball Foundation, kind of looking at those different domains and what the quote unquote, gold standard was for those. They then collected pitch count as well as post-game phone interviews with yes or no questions, such as, did your arm get tired while pitching? Did you get stiff or tight after pitching? Any pain in your elbow from pitching or shoulder? Or did you feel any pain on the other part of your arm? So 15% of the pitching appearances resulted in shoulder or elbow pain, and half of those participants experienced shoulder or elbow pain during the season. Again, kind of like what Dan was saying, when we look at pitch type, specifically, it seems like curveball is associated with an increased risk of shoulder pain at 52%. Only 14% of the pitchers threw a slider, which is similar to a curveball, but it has more horizontal break as opposed to a curveball, which is more of a vertical break. But that was associated with an 86% increased risk of elbow pain. And specifically, that was seen in the the older age group, 13 to 14-year-olds. Again, if you're following online on the video version, you can see that that has a pretty significant change in the table shown. In terms of their video analysis, again, this was, relatively new. This was in 2002, so not quite to the video analysis that we have today, but they found no differences in shoulder or elbow pain. So in conclusion, they found that the pitchers in this age group should be cautioned about throwing those breaking pitches, the curveballs and sliders, because of the increased risk of elbow and shoulder pain. Similar to Dan's study, they found that there was a decreased risk with the changeup. They also, again, advocated for the limitation of pitches thrown in a game and a season, and that can also reduce the risk. And they recommended that pitchers between 9 and 14 years old do not throw the curveball or slider, pitch count of 75 pitches per game and 600 per season, and they can't pitch in different leagues, kind of avoiding those different pitch count limits. And then they go on to say further evaluation of pain and pitching mechanisms is necessary, and that is obviously carried on to this day with more advanced video analysis. They actually said in their paper that a lot of their video analysis was later in the evening and there was low lighting, so a lot of their video analysis was pretty limited, and I definitely don't think that's the case anymore, especially if you look at these high-level athletes. Obviously, this was a youth study, but the high-level athletes have state-of-the-art, video monitoring with 5 different cameras looking at them and then breaking that down and analyzing it. So I thought these few studies that looked at video analysis, even this early on, were, really paving the way for our later, newer studies. And that will get into our last study for the night.
Great. So the next study is titled Risk Factors for Shoulder and Elbow Injuries in Adolescent Baseball Pitchers. This was a study that was published in the AJSM by Dr. Olsen and al. Out of ASMI in 2006. So just to give a little basis of this study, at the time, the USA Baseball Medical and Safety Advisory Committee had recently published some recommendations on injury prevention. This included things such as monitoring pitch counts, avoiding throwing breaking pitches until puberty, avoid returning to the mound after being removed from the game, and a couple other generalized recommendations. But most of these recommendations were based upon little scientific evidence support in the current literature. So the purpose of this study was to identify specific risk factors that could predispose an adolescent pitcher to a significant shoulder or elbow injury. They believed that there were significant differences in pitching practices between a healthy adolescent pitcher and an adolescent pitcher that would then go on to have a shoulder or elbow injury. This overall study design was a single surgeon retrospective case control study. They had healthy adolescent pitchers, meaning no previous elbow or shoulder injuries or surgeries, who were aged between 14 and 20 years old, who eventually sustained a arm injury or shoulder or elbow injury to their dominant pitching arm. And this had to happen within the last year. This was during 2003 to 2004. They utilized an injury recall questionnaire survey. They divided the two groups in the elbow injury group and the shoulder injury group. And again, they excluded any adolescent who had any history of shoulder and elbow pain that lasted greater than 2 weeks, that kept them out of practice or game, or that they have had recurrence of elbow or shoulder injury pain in the past. So overall, they had 66 participants in the elbow injury subgroup. The most common surgical intervention that they had was UCL reconstruction, and in the shoulder injury subgroup, they had 29 participants, with the most common surgical intervention being labor repair. Of that, they divided the variables that they analyzed into non-modifiable, preventative, and competition habits based off the questionnaire that they would then go and have these participants fill out. In terms of the results, it was really grouped into 3 different groups, one being the overall injury group. And so what they found is that there were a number of variables that were statistically significant for these individuals to end up suffering an injury. This included pitching more months per year compared to the non-injury control group, more warm-up pitches per game, pitched in more showcases, more likely to be a starter, pitch with higher velocity, more likely to have arm pain and fatigue, more likely to have used NSAIDs and ice more frequently for injury prevention compared to the control group. All of these variables were also statistically significant for the elbow injury group as well. For the shoulder injury group, the variables that they analyzed and found to be statistically significant included pitched more months per year, pitched more innings per game, more pitches per game, more pitches per year, more warm-up pitches per game, pitched in more showcases, pitched with higher velocity and despite fatigue, and then also utilized NSAIDs more frequently for injury prevention. So out of all those different variables that they utilized in the questionnaire survey, they found 4 that had the highest significant risks, one being pitching more than 8 months per year, that put participants at a 5 times more likely increased risk to suffer injury that requires surgery. Pitching more than 80 pitches per game increased the likelihood by 4 times to require a surgical intervention. Pitching fastball speeds greater than 85 miles per hour had a 2.5-fold increase in injury risk, and then pitching often despite arm fatigue had a 36-fold injury increased risk. So in all, they were able to identify multiple variables that were significant for injury prevention in pitching practices, with overuse and kind of a number of different categories of overuse being the major risk for injury. And so they developed some recommendations overall for adolescent baseball pitchers. This included avoiding pitching with arm fatigue, avoid pitching with arm pain, avoiding pitching too much, specifically avoiding more than 80 pitches per game, avoid pitching more than 8 months per year, avoid pitching more than 2,500 pitches in competition per year. And then they also had some more generalized recommendations that they developed, such as monitoring pitchers who had these type of characteristics, including pitchers who regularly use NSAIDs and ice to prevent injury, regular starting pitchers, pitchers who threw with velocity greater than 85 miles per hour, taller and heavier pitchers, pitchers who warmed up excessively compared to the control, and then pitchers who frequently participated in showcases. They wanted more monitoring on for injury prevention. So again, this was a retrospective recall survey study. And so some of the items such as pitches per year were estimated based off the recall for a specific game. And so overall, this study was able to identify some specific variables that may lead to an increase in risk for shoulder or elbow injury in these adolescent pitchers. Again, it's not a cause and effect study, but more was able to identify specific risks, and then based off these risks identification, input specific recommendations to avoid them.
Yeah, thank you for that, Jalen. Great way to kind of end that. I think one of the biggest things that I took away from that one as well was just, they showed all of these different risk factors. And I mean, it was like 2 to 5, fold increased risk, and then pitching through fatigue, 36 times fold increase in risk to injury. So that is definitely pretty significant. And even the ones that was, my arm infrequently hurts, it was still a 4-fold increase. So fatigue is definitely something to watch out, and probably a big risk factor in these younger athletes. But with that, that concludes our episode of our shoulder and elbow Citations Classic, specifically looking at shoulder and elbow injuries in the throwing athletes. So thank you all for joining. Thank you all for listening. It is also Bills game night, so go Bills, and we'll catch you guys for the next one.